Hello, everyone. It's December the 21st. I'm not absolutely positive of this, but I think that December the 21st is the first day of winter. And I also believe that today is the shortest sunlight day that we have of the year, or yesterday. I'm not positive of that as well, but we've had an additional 38 deaths in West Virginia since we came together on Friday. I'm going to read those to you now. We're now up to 1,129 deaths in West Virginia. You know, it's hard for me to sit here and tell you that, well, that's better than it was on Friday, because Friday we read 60 deaths, but 38 deaths is unbelievable. Our 1,092nd death is a 77-year-old male from Marion County. Our 1,093rd death, an 82-year-old male from Raleigh County. Our 1,094th death, an 82-year-old male from Mineral County. Our 1,095th death, a 75-year-old male from Marshall County. Our 1,096th death, an 82-year-old female from Greenbrier County. Our 1,097th death, a 75-year-old male from Marshall County. Our 1,098th death, a 90-year-old female from Jefferson County. Our 1,099th death, a 69-year-old female from Berkeley County. Our 1,100th death is an 81-year-old male from Hancock County. Our 1,101st death is a 65-year-old female from Gilmer County. Our 1,102nd death, a 76-year-old male from Hancock County. Our 1,103rd death, a 90-year-old male from Greenbrier County. Our 1,104th death, a 70-year-old male from Hancock County. Our 1,105th death, a 50-year-old male from Marshall County. Our 1,106th death, a 67-year-old male from Raleigh County. Our 1,107th death, an 88-year-old female from Hancock County. Our 1,108th death, an 86-year-old female from Jefferson County. Our 1,109th death, a 64-year-old male from Wood County. Our 1,110th death, a 74-year-old female from Cabell County. Our 1,111th death, a 77-year-old female from Kanawha County. Our 1,112th death, a 72-year-old male from Morgan County. Our 1,113th death, a 58-year-old male from Hampshire County. Our 1,114th death is another beautiful lady, a 101-year-old female from Monongahela County. Our 1,115th death, an 87-year-old female from Putnam County. Our 1,116th death, an 86-year-old female from Cabell County. Our 1,117th death, a 79-year-old female from Kanawha County. Our 1,118th death, a 68-year-old male from Monongahela County. Our 1,119th death, a 78-year-old female from Kanawha County. Our 1,120th death, a 93-year-old male from Harrison County. Our 1,121st death, a 70-year-old male from Morgan County. Our 1,122nd death is an 81-year-old male from Marshall County. Our 1,123rd death is a 57-year-old male from Randolph County. Our 1,124th death is a 72-year-old female from Taylor County. Our 1,125th death is an 84-year-old male from Marion County. Our 1,126th death is an 86-year-old male from Grant County. Our 1,127th death is an 81-year-old female from Kanawha County. Our 1,128th death, a 72-year-old female from Grant County. And our 1,129th death, a 93-year-old male from Wayne County. I say it over and over, please, 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 don't let these people just become a number. Keep them in your prayers, keep them in your thoughts, especially at this time of year, but really at all times. We're losing great West Virginians. And can you imagine the knowledge that we're losing? We're losing our elderly with the experience to pass on their trades, all the things that they've lived through their life. Please keep them in your thoughts and your prayers. In the last 24 hours, we're slightly below 1,000 on our new positive tests or cases, 995. We have a daily positivity rate of 7.19, probably because we just didn't test as many. Our cumulative positive is now at 4.38. Our active cases are almost 23,000, and our recovered cases are heading towards 50,000. We have 695 hospitalized and 167 in the ICU, and both that is probably down just a teeny little bit. Over the weekend, we did test 22,744 West Virginians. Our RT rating, or our reproduction number, is at 1.12. You know that number needs to be below 1. We're at 1.12. We're the 6th worst in the entire United States. We have a total of 46 counties that are in the orange and the red, 32 in the red now, 14 in the orange. I go over this over and over, but you'll see how the CDC now is adopting our ways again. West Virginia leading the way. We came out and we said, look, it's all about age. It's not about who has the chronic illness and all that. It's about age. We better focus to age. And you better listen to me. If you're 65 years of age and you get feeling the least bit bad, go get a test. If you go get a test and we can catch this in the first few days, you're going to probably be okay. If you dink around with this and let it drag on and thinking it's a cold or a headache or whatever like that, and you don't go get a test, and then you're out 6 or 7 days, the hospitals will try with all in them to save you. But it will be much, much, much more difficult because the drugs that will work in the first few days aren't much good after 6 days. You know, it's just as simple as mud. 77.5% of our people are the most elderly that are dying. You have to listen to me. I had my vaccine, I guess it was last Monday, and still feel just great and everything. Look forward to taking the follow-up, I want to read to you just a little bit here where West Virginians, you ought to be really proud again. Proud of what we're doing in government, proud of what our National Guard and all of our health officials and everybody are doing. But West Virginia is leading the nation in the rate of COVID vaccine distribution and administration. As of this morning, West Virginia had administered 15,135 doses of the 16,575 that we got, which was 91.3% is the administration rate right now. According to Bloomberg.com, this was the highest and best administrative rate of any state in the country. Just think, while other states all around the nation are sitting around trying to come up with a plan, we're not waiting in West Virginia. We're getting it done. And with the great help of the amazing National Guard, our health experts at DHHR, our local partners, we're all on top of this. We're administering the vaccines as quickly as we get them. Now it's up to our West Virginians to answer the call and take the vaccine when it becomes available to you. You know, another safe, more on our distribution numbers, another safe, quality, effective vaccine is coming to West Virginia late on Friday. The FDA approved Moderna. You know, that vaccine, as well as the additional doses of the Pfizer vaccine, will be arriving in West Virginia today. Now get this, we're expecting an allocation from Moderna of 44,300 vaccine doses of this product, and the Pfizer product, that will be the total this week. You know, so it's bumping up really fast. You know, the National Guard all over this. There's all kinds of stuff on our dashboard and everything, information is showing you all kinds of different things there. And so as what we want to continue to do, we want to continue to pump this stuff out as fast as we possibly can, lead the nation in every way, and stay on top of it and trying to help our people. From the standpoint of our long-term care vaccination, West Virginia is leading the nation in distribution of the COVID vaccines to our nursing homes and assisted living. We were the first state in the country to require nursing homes and assisted living to test all their residents and the staff. And I want so badly to be the first in the country to get all of our nursing home residents and staff vaccinated with the vaccine. West Virginia took a slightly different plan than the rest of the country. I told my team that I wanted the long-term care residents and the staff prioritized and wanted the first doses completed within 1 month. So we are executing the plan that relies upon our greatest resource, our fellow West Virginians, to take care of one another and help distribute this vaccine through expanded use of all the local pharmacies. We got all the pharmacies on board. Everybody started moving very, very quickly. Now get this, we anticipate finishing with our nursing homes and our assisted living homes and everything. We anticipate finishing by Monday, December the 28th. You know, quite literally, we may be finishing our vaccine to long-term care facilities before the other states even start. It's really quite a tribute to our National Guard, all of our health teams, and everybody that's really working this. So stay after it, guys. Way to go. That's really great stuff. Yesterday, the CDC's ACIP committee met to discuss recommendations for who should be vaccinated next. In their discussions and recommendations, they outlined that essential workers and those who are 75 years of age and older should be the next to receive the vaccine. Now, doesn't that sound familiar? Doesn't that sound just terribly familiar? And Dr. Marsh will talk a whole bunch about that in just a little bit. Vaccine reminders are just what we said over and over. There's been tens of thousands of people that were tested. Tens of thousands of people went through the trials. Absolutely, you cannot get COVID from taking the vaccine. You know, without any question in my mind, you know, this hesitancy to take the vaccine or stubbornness or whatever you want to call is going to lead to just a lot of people that aren't taking the vaccine that die. Now, to me, you know, on Laugh-In years and years ago, they had a dumb bunny or something like that. Well, you don't want to be the dumb bunny here. You need to really think about what the science is and all the people and all the side effects and everything of the vaccine. And it has been proven over and over with the great work of our FDA and CDC and all the different people and everything. It is absolutely safe to take, and I strongly encourage you to take the vaccine. Okay, we got some more great stuff that's going on right here in this great state of West Virginia in Mercer County. And I want to take a minute today to highlight one of the local health departments from Mercer County that's doing outstanding work and that has been taking place under the direction, and I'm going to probably mess Stephen's name up here, but Dr. Stephen Stefanczyk, I think is I said that maybe pretty good. Maybe I got that right. But our local health departments are in the front lines in our communities, and they're the ones that are fighting this. And Dr. Stefanczyk has developed a plan to meet the needs in his community for the vaccine as it arrives in larger amounts. We know that there are many local health department heroes who are doing similar work and have been working around the clock since March to take care of their communities. I'm happy to introduce Dr. Stefanczyk, and who is joining us virtually today, and he's going to give you some insight and on great stuff that's going on right there in Mercer County, and it's good stuff. So, Doc, thank you for being with us.
Thank you, Governor, and thanks for having me. Just to touch base and update everyone on what we've been doing in Mercer County. Throughout training, especially in rural settings, we know that access to healthcare can be difficult. This could be because of transportation. It could be because of general isolation. West Virginia has a lot of absolute wonderful communities. They just tend to be a little far from the central hubs of the county seats and larger access points. So in order to help combat that and get the vaccine to the people, we came up with a plan, working with our emergency preparedness, working with our emergency responders, local individuals, emergency shelters, so on and so forth to do so. What we have done is we've developed a tentative mobile vaccine plan. We have partnered with a number of different agencies in essentially being prepared to give the vaccine with no resources available. We have portable electricity. We've got portable tents. We're working with our local 911 and emergency management to incorporate other agencies in this as well, as far as traffic control and generalized safety. We want to emphasize that we're here for the community. We're here for the state. We're happy to adjust this as needed as time goes on. We know with COVID, it changes every day. Vaccines can change as far as rollouts, and we want to be prepared for that. In doing so, we sometimes don't know what we're going to be tasked with the next week. So we're ready for anything. We have shelter. We've partnered with local community organizations and have access to large sound structures in large areas of land. If we need to do a mobile clinic or even a mobile clinic within a structure, we have that secured. We want to make sure access is there for the people. We trust in the process of the vaccine, and we want to make sure the community trusts in how the vaccine is getting out to them. In doing so, one of the concerns we've learned is, as with anything, there's an allergic reaction. I have asked with any type of mobile clinic in the local communities that an ambulance be requested to be present, in addition to having emergency medicine on site. Through event medicine, through emergency medicine, through pre-hospital medicine, we know that the faster and treatment can be rendered to an individual, the better it will be. That being said, allergic reactions are rare. We know they don't happen frequently, but we want to make sure the community is comfortable in getting the vaccine. We recommend it. We know how important it is. This is one of the biggest tools we have in our toolbox to help everyone. And we want to make sure that everyone feels comfortable in receiving that. And that could mean just having the extra insurance policy of having an emergency kit ready. We actually, I'm pleased to report, we had our first mobile clinic this past week at one of our local rescue squads. Princeton Rescue Squad has a new emergency shelter community center, and we were able to vaccinate pre-hospital providers. We had a wonderful turnout. We were able to vaccinate other EMS agencies, Bluefield Rescue Squad as well at their building, but we were able to cater to the community based upon these emergency shelters that are in place. We're growing from that. We want to provide all of our area the opportunity to get the vaccine. We understand that there might be transportation issues. We understand it might be a long trip as far as traveling from the edge of the county to the center of the county. we want to take it to our citizens. Governor, I want to thank you for hosting me and allowing me to participate in this. Thanks for your heart for the state, and I appreciate being able to share what we're doing down here and help others throughout the state.
No, Doc, thank you so much. And it's just another tribute to West Virginia, isn't it? It's just another tribute to how West Virginians step up and are doing absolutely great stuff for our citizens. And it just happens over and over and over. It's really a blessed state with really smart people. Now, I've got one more thing I'm going to show you real quick, but I've told you over and over about these masks and the value of the mask and everything. You saw a little video or a little promo that, where Chris Christie had gotten COVID and really struggled in the ICU unit, I think it said, for 7 days and survived. And he was pleading with people to wear your mask. Well, the great people in Cabell County, have now put out a video, and it's called "It's Not Forever," meaning these masks are not forever. You're not going to have to wear this mask forever. It's not forever. It's for each other. And so I want to show you this now. I think it's great, and it was put together really well, but take heed. If you're not wearing that mask, just please watch. And if you are wearing it, please watch as well and everything, and just be better at wearing it and helping us get through this.
We see you. We hear you. We know it's not been the easiest of times, but the citizens of Cabell County know that tough times don't last, but tough people do.
We do this at the fire department to keep everyone safe.
I do this for my patients and for all my healthcare coworkers.
So we can get back to being a community again.
For Gigi and Papa.
So we can have live music back again.
I'm doing this for the frontline workers.
So we could get back to ordinary fellowship again.
I'm doing this for our city.
I'm doing this so I can hug my kids again. And there's a lot of them that I need to hug.
We may have been apart, but we have all been in this together.
I'm doing this so we can see our family and friends again.
To protect my neighbor.
To keep the Marshall family safe and healthy.
I'm doing this so I can spend time with family and friends again.
For my friends and family.
To keep Mommy and Daddy safe.
Every choice we make affects you, your family, businesses, and our community. But we're almost there. Stay strong, because
it's not forever.
It's not forever.
It's not forever.
It's for each other.
It's for each other. It's for each other.
It's for each other. It's not forever. It's for each other.
That's a great job. Great job, Cabell County, and thank you so much. Your message is ever so clear, and it's very, very well done. Thank you again. Okay, I'm gonna get through the rest of this pretty quickly here, but you know how you can take advantage of all of our free testing. That's up on our map. You can see all the stuff on our website, where you can go and all that. All you got to do is pull that up. We thank Fruth and Walgreens for the drive-through pharmacy testing that they've done, which is unbelievable. I've already spoke to this, but the Saturday education map showed 32 counties in red and 15 counties in orange. I think if you'll just take 1 second and you'll look at that map, you'll just say to yourself, West Virginia has border states all the way around it. All the way around it. Look at where all the problem is, all the way around it. The heart and the guts of West Virginia, pretty decent shape. Not great shape, but all the way around it is really bad, really, really bad. Okay, we've got school outbreaks in 14 active outbreaks with 79 confirmed cases in our public school system. We're continuing to work that and look at what is going to happen when we come back to school after the break. we all know, and no one knows more than I, and no one is more insistent than I, we want to be safe. We want to be super safe to our children, our teachers, our service personnel, all those that are involved. But we have got to get our kids in school. We have to have our kids in school. You can't fathom what is really happening to our kids by not being in school. It's not good. It's just not good. And so we're working it as hard as I know we possibly can. I would highly recommend, as these vaccines continue to roll out and people are working right through Christmas like it's just another day and everything, and in order to get the vaccines to you and everything, please, please, really step up and take this vaccine and help us get rid of this thing. We have 15 outbreaks in churches in 14 counties. That's Braxton, Greenbrier, Harrison, Jackson, Lewis, Marion, Mineral, Mingo, Monongahela, Nicholas, Raleigh, Summers, Webster, and Wyoming counties. You know, and, I go through the same thing, but a pew in between you, mask, and everything. And absolutely, if you're 65, you probably should really think really hard about going and getting your church services online and just staying away just a little while now. Just like that video said, this is not forever, it's for each other. It's not forever. We're on a glide path now to where in the next very few months, we ought to really be turning this thing around. At corrections, we have 199 inmates that are positive right now, 72 at St. Mary's, 61 at the Eastern Regional Jail, 36 at the Central Regional Jail, and 55 with our staff. And you can see just how this runs. I mean, if you'll remember what happened in McDowell County, if you remember what happened in the Northern Regional Jail, if you just remember what has happened at Huttonsville, how this runs through, communities and everything once it's there. But boy, corrections, way to go. You've done amazing, amazing stuff. There's no point in me going through more about wearing your mask. You got to do that. The flu vaccine is right around the corner, or right with us right now. Please consider taking that and giving blood and plasma. It's just, especially if you've been infected and you've recovered, that's a really, really great thing to be doing. The only other thing, and I know it's way down the totem pole as far as the gravity of the situation, but we are stocking a ton of fish in West Virginia now. Buy your hunting and fishing license and get yourself enrolled in that drawing and everything. You may be a big winner. You may be a winner of lifetime hunting and fishing license and everything. So get buy your hunting and fishing license. It helps our DNR, and really and truly, it's just a great thing to be able to get out and enjoy the outdoors, which is, there's no point in me going through it again. It's just phenomenal. That's all there is to it. West Virginia, there's no place like it. And when you can really truly see that scarlet tanager, you can really see it. Not just look at it, you can really see it. It will change and it will help your soul. Now, there's a stimulus package that is almost, now there is a bipartisan deal. Yesterday evening, the Senate Majority Leader, Mitch McConnell, announced that the deal will apparently tie a $1.4 trillion bill to fund the government until October the 1st to roughly $900 billion in COVID relief. Now, there's many things about this that I could tell you that I think are going to happen, but there's going to be substantial abilities for those, especially in the hospitality restaurant business or whatever like that have been affected probably the most severe of all, as our small restaurants, But not only that, all the people that are unemployed, there'll be immediate stimulus checks coming. I think those checks are going to be, in the neighborhood of $600, and there's going to be bonus money to the unemployment of I think of $300 a week. But there's lots of parts about this that I think will be really great for our people and especially our businesses that are really hurting. As far as dollars flowing to the state or to cities, as the Democrats have really wanted more than anything, I think that is completely off the table now. I think the trade-off there was the Republicans were wanting a very strict limited liability, that if you got COVID and you were infected at a restaurant or whatever, that the restaurant, surely to goodness, a restaurant can't be held accountable for all this stuff. But people, the last thing we need to start doing now is coming up with a way of suing our businesses or whatever, and because you'll just put more and more and more of them under and out of business. But nevertheless, I think that was the big holdout from the Republican side, and the big holdout from the Democrat side was money to the states and the cities. I think they've just laid that aside for right now, which is probably smart money, and they've tried to just do something that should have been done, God knows, months ago, and that's just help our people and our small businesses and everything. And then I guess they'll retake up the situation as far as the state's funding or cities' fundings and this limited liability issue. But we should see that. It ought to be on the way. And so from the standpoint of our small businesses and our people and everything, it's a little bit of light at the end of the tunnel. So that's all I have today, but I'm sure we'll get questions, and I'll think of some stuff I've forgotten.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As Governor pointed out, we're receiving more vaccines this week, both now from Pfizer and Moderna. We have received an initial shipment of Moderna vaccine, the balance of which will come tomorrow. The Pfizer vaccine is coming tomorrow as well. As the governor pointed out, we will be working diligently with DHHR and our other partners through this week as local health departments, and we will continue to press through. We have some great numbers that we've seen with the work with our partners at the long-term care facilities. Actually have exceeded the numbers that we had anticipated the last week in the number of facilities that we would be able to serve last week. Actually went up to 71 facilities. We have an aggressive plan this week that works through the holidays with the exception of the Christmas day. We'll continue to press to meet the governor's objectives. We believe that no later than 31 December, we will have touched all 214 long-term care facilities, staff and residents who will be taking the vaccine. A monumental task by a lot of different folks. And again, the governor, the Joint Interagency Task Force team appreciate the great work that's going on. Just to give you an example too, last week, over 15 pharmacies participated and helped us. This week, over 40 pharmacies will be assisting us as we go forward. Last thing, on behalf of the Interagency Task Force, I want to thank Dr. Stefancic and his innovation with the efforts. We will need a lot of innovation like that going forward as we get into phase 2 and the general population in particular. And we thank him for the great work and the innovation and the partnership. Thank you.
Thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. It's always a pleasure to be with everybody. As the governor has said, we continue to do very, very well, both as the governor and General Hoyer have pointed out in the utilization of the vaccines that we've received. Remember, we've said before, it's not how many vaccines you receive, it's how many vaccinations that we do. So it's really important that every West Virginian, when it's your time to get vaccinated, stands up and does so. Because not only is wearing a mask part of serving each other and serving our communities, but so is getting vaccinated. And to that end, as General Hoyer said, and the governor said, that Moderna has been approved for emergency use authorization. Remember, Moderna and Pfizer vaccines, which are the two vaccines that we have right now, are made really the same. The difference between the two is that the way the fat dropules that are coating the Moderna vaccine, which is how they're packaged so that they get into our cells very easily. And then remember, they are instructions for only that limited part of the virus, the spike protein, to be made by our cells. And that then induces our bodies to make immune responses against just the spike protein. So the vaccines cannot cause an infection, does not cause sterility, is really okay for everybody to take, except for people that are allergic to the constituents in the vaccine itself, or people that are actively infected with COVID-19 and are in their isolation period. But these vaccines are really safe. We've all taken them ourselves, and I, like the governor, have no effects at all from taking the vaccine now, other than to know that I have done my part to try to protect other people that are dear to me. And I also want to thank Dr. Stefancic for his innovation and his leadership as one of our county health officers representing our local health departments, and is really the great work of all of us together that makes the biggest difference. As the governor said, the Advisory Committee for Immunization Practices, a subcommittee for the Centers of Disease Control, met, and they're the group that really has the most expertise to recommend to the Centers for Disease Control what the priorities are for this next phase of vaccination. And, I'm very proud of the fact that we have done so well, as the general said, with our task force and the number of people that we have involved, from pharmacies to physicians to healthcare workers to nursing homes to hospitals. We have done an amazing job to date of putting vaccines in the arms of people. And just like we had planned, looking at critical business and industry sectors and healthcare as our high priority to maintain that function and capacity of hospitals and communities. That's what this committee, this guiding committee, recommended to the CDC. And they also really focused on what the governor's talked about now for the last week, is what Dr. Birx also re-emphasized to us, that it's really about the age of people. And this recommendation group recommended for people 75 and older. And as you know, our plan starts to focus on people 50 and over for the key industry sectors and the key other hospital sectors other than the acute hospital settings of ICUs and emergency departments and COVID units. And as we immunize West Virginians over 50 years old, we will start to focus on that group by age that makes up 97% of the deaths that we've seen in West Virginia. And then we get to the really most aged part of our population. And as the governor said, the folks over 70 years old make up 77.5% of the ages that cover the deaths that we've seen in West Virginia, and also are the people that have the tendency to get sickest, which take up acute hospital beds, which puts more pressure on those hospitals. The last thing I want to say, and this is really in many ways giving homage to this great video that we saw from Cabell County, that there is reports out of the United Kingdom that there is a virus, COVID virus, that's mutating there that may enhance the ability of the virus to spread person to person, does not seem to increase the severity of the virus. And that's because we're seeing mutations in the United Kingdom in the spike protein. And that's, again, we've talked about, that's the part of the virus that binds to the cells in our body. That's the part of the virus that all of these immunizations are trying to help us, recognize and defeat if the virus does get in us. But it really does underscore the real importance, as the governor said, of really being diligent with wearing masks and paying a lot of attention. I think Dr. Amjad and Secretary Crouch will talk about this over the Christmas break, because maybe we're seeing kind of a reduction, very close, very temporary, very early reduction in hospitalizations from the Thanksgiving break. But now with the holidays coming up, it's a really critical time for us to pay so much attention to reducing the things that will transmit the virus person to person, which does certainly include wearing masks and staying physically distanced. So West Virginia, you're doing amazing. We're so proud of each citizen, but when it's your time to stand up, please stand up and serve as you've done in many times before. Thank you.
All right, thank you, Dr. Marsh. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Hello, everyone. Let me also say thank you to Dr. Stefancic. It's done a wonderful job. For those who aren't aware, he's not been the local health officer in Mercer County for very long, but certainly making a difference very quickly down there. So we thank you for your service and for your work. Also to Dr. Mike Kilkenny, I want to say thank you, and to the folks in Cabell, Huntington, and in Cabell, in Cabell County and Huntington for their work on that video. It is exactly the message we need right now, and it's well done. Thank you for that. I want to talk a minute about the testing map. As we go through the holidays, we want to make sure everyone is aware of where testing is. Very difficult to keep testing up right now. We want everyone to have some time off over Christmas. We have a lot of folks in DHHR and in the Guard who have small children and who have been instrumental in keeping things going. And we want to make sure that they relax some and have time off with their family over this holiday. So what you see now is the map. There's been some confusion. We've had questions, so I want to see if I can clear this up a little bit. As you see, and the tab to the free testing is very easy to find on our dashboard page up on the right-hand corner. At the top of this map, there are two filters. One is for testing sites, all testing sites. If you tap on that number, I'm not sure if you can see that, but it says all testing sites, daily testing sites, which are those sites in blue. So if you touch that, you see only the daily testing events. If you touch the recurring testing events, you will see the red tabs on the map, which shows those testing events which are recurring and which are daily. The final tab is the pharmacy testing, and those tabs show up in yellow. Let me mention, you can touch on any, if you have a touch screen, you can touch on any of those tabs on the map, and it will give you where that testing is, the location of that testing, and in many instances, it gives you additional information, but it does give the dates and times and availability of testing. Again, some of these have additional information as you touch those with regard to recurring events or daily events to help you get access to locations of this testing. The tab on the right, the filter is view as a list. That is the green tab, and you will see, you can actually see a list of those testing sites if you'd rather look at those on a list. You can further, in the right, up on the right column under the blue tab is a search box. You can type in the name of the county, of your county, and it will filter those test sites to just your county so that you can then access all of the testing locations, whether those are recurring or whether those are pharmacies, et cetera. Again, as we go through the holiday period here, we want to make sure testing is available. Today, we have testing in 50 of 55 counties offering testing of some kind. As I mentioned, We want to continue testing through the holidays while staff, and I didn't mention local health departments, and I certainly need to do that. Staff at local health departments also need to take time off with their families for Christmas. It's something we're trying to make sure everyone has the ability to do. But with that, we still need to keep the dashboard running. We need to make sure everything is continues with regard to our data, et cetera. So please be thankful for folks out there in the counties who are on the front lines who are doing this work for us and for everyone. So encourage everyone to test. If you have any questions, go to the dashboard. We will provide any additional information we can as you need it. So thank you, everyone. Wear your mask as the governor has asked. Thank you.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first question today is from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I wanted to ask Dr. Marsh, back in March, I had talked to a university president, and he had told me that they had been told back then to look for a fall surge, and I wanted to know if we have any indication on which direction the virus is going to go from here now that we have a vaccine. What kind of assumptions are we making with regard to where it will go from here? Thank you.
Dr. Marsh, go.
Okay, well, thank you, Paul. So we anticipate, given the colder weather coming up and the more indoor connections between people, that the next couple months is going to be a very big risk time for all of us in the United States and in West Virginia. So it's very important to pay particular attention to this time. We know that with the vaccinations, the vaccinations require 2 separate vaccinations from both the Pfizer product and the Moderna product. The Pfizer product spread out around 3 weeks between, and the Moderna product about 4 weeks between. And we know it takes a little bit of time after that to get the full immune response, although you will have some immune response after the first dose. So we anticipate the next couple months is going to be a time that, despite our immunization, which should help some, is a time that every West Virginian needs to be particularly focused on reducing their individual risk of getting COVID and spreading COVID. And that really does mean avoiding indoor places and crowds, wear your mask, stay distance as much as you possibly can, and be very, very aware of the situations for right now. After a couple months, 3 months, we get the vaccine, we think things will really let up quite a bit as we get into the spring and it gets warmer outside. But this time is a time that we all have to be very, very cautious and take the most precautions. So thanks for the question.
Yeah, thanks, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this dovetails onto Paul's question a bit. With what we've seen in Thanksgiving, 2 weeks out, we saw the surge in cases. Then a week later, we saw hospitalizations hit new records. And a week after that, which is kind of the space we're getting into now, it starts to decline a little bit. What are you expecting, Dr. Marsh, as we head into Christmas, given the trend that we saw at Thanksgiving and given the fact that still most of the spread is from small groups of people getting together? Thank you.
Doc, go ahead.
Okay. Well, I think that really, Kenny, and sort of moving forward from Paul's question, I think it really does underscore the fact that the future of our state and the future of the health of each county is in each one of our hands coming into this holiday break. And you're absolutely right, about 2 to 4 weeks after we see transmission happen is when we see hospitalizations and deaths. And maybe that wave is crested a little bit from the Thanksgiving break. And remember, the Thanksgiving breaks where we saw the most mobility based on cell phone data. So we saw more movement of people around the United States than ever before in the duration of this pandemic. And by TSA, we saw more people traveling. So this winter holiday, whether it's Christmas for your family or Hanukkah or Kwanzaa or whatever it is, this is a time that we have to be particularly focused because we still have warmer weather around Thanksgiving. So we would anticipate that if people do the same thing around the Christmas, Kwanzaa, Hanukkah holidays as they did around Thanksgiving, that things actually will be worse coming up because we're already more full in our hospitals and we already have more cases of COVID on a daily basis than we did around Thanksgiving. So it's really, really important that people pay a lot of attention right now.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. The governor said we've used 91.3% of the vaccine we've been given so far. What accounts for the other 9% and change? And what are we doing to ensure that we're not wasting any of this precious resource? Is a certain amount of waste inevitable, or are we going to try and get to that 100% number? Thank you.
General Hoyer, this is you, sir.
Yes, sir. Yes, Governor. So the number is actually a little bit higher now as we just got our updated numbers. The primary reason for the part that has yet to be executed is the local health departments or other entities that are being prepared to execute that are not ready to receive it. Therefore, we keep it because understand the Pfizer vaccine is an exceptionally difficult environmentally controlled vaccine. So to keep it in the cold storage facilities at the hubs and then push it out when it is ready to actually be administered as a vaccine is the appropriate way for us to handle that. We're on track to execute 100% of our first group of doses. It takes a little bit longer when you have weather issues and other factors of local health departments needing certain things to prepare. But we are on track, and as opposed to wasting doses, we have actually had pharmacists who have been able to get additional doses, that 6th dose, out of vials. So we will probably come in ahead. The other thing I'd point out, just so you understand the complexity of this, we're now managing Pfizer vaccine with one set of environmental control systems, Moderna vaccine with another set, and preparing to be able to execute the 2nd dose of those first Pfizer vaccines that are instituted. So this is a very complex operation, and we're doing, I think, an exceptional job moving forward.
All right, thank you, Charles. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. A little bit ago, we talked about how many counties are red and orange and the effort to try to get kids back in school after the holiday break. Is that effort mainly dependent on the vaccine effort, or are there other new factors that may contribute to getting kids back in school? Thanks.
Brad, that's me. Let me answer this. That it's not mainly on the vaccine. The vaccine surely is the elephant in the room, and that's the biggie. But from the standpoint of we're looking at everything. We're looking at from the standpoint of our kids that are middle school kids, maybe from the age of 13 down and everything. With those kids, as far as transmission of it, are minuscule, extremely minuscule. We have even been looking at from the standpoint of, and I just got this news earlier today, but from the standpoint of offering up the vaccine and vaccinating all of our teachers and service personnel in our schools K through 12, it's about 24,000, and so there's lots of different possibilities here of maybe what we can do after we go through, the Christmas break, and we look at, where we stand at that time. And that 24,000 was not all the teachers and all the service personnel. That 24,000 was all those in the age of 50 and above. But there's a lot of stuff that's going on within the education arena, and the bottom line is just one thing and one thing alone. All of us know the repercussions of not having these kids in school, and it is unbelievable that we need our kids in school. we need them in school really bad. And so we're working it, and we'll just continue to work it. And the vaccines, no question, going to help in the biggest ways, but we need to be also looking at, maybe other methodologies that we can do after this break, and we hope and pray this thing will back off some.
All right, thank you, Brad. Next to Kimberly Keggy with WSAZ.
Hi, Governor. Good afternoon. I did want to ask you about the CARES money. So as the end of the year is approaching, we still have millions of dollars in West Virginia that we haven't spent from the CARES money that Congress gave us. So what are we doing from the state level to make sure that money is spent by the end of the year before it expires? Thank you.
Okay, is this Melanie? Kimberly. I'm sorry, Kimberly. Kimberly, I've been through this 15 times. We went through an extensive evaluation on this from the standpoint of last Friday. We have been through it. You can rest assured that the dollars will be spent. And the other thing that'll be coming on top of all this is they're now going to extend the CARES deadline and everything. And so they're going to extend past December the 30th. But we're still going to go with our plan, the plan that we have in place and everything, and how we're moving forward with that. I think we've got a small little buffer cushion now of somewhere in the high 30 million, 38 or whatever million, $39 million. But from that standpoint, from $1 billion to 252, because the 2 was really 2.5 million that we've earned in interest. From the standpoint of how we've maneuvered the money and everything, it's done right. And at the end of the day, there's not any great big backlog of money that's going to be there on December 30th.
All right, thank you, Kimberly. Next is Steve Adams with Ogden Newspapers.
Steve Adams with Ogden Newspapers. And Governor, you just answered the question I was going to ask you. I was going to ask specifically about what conversations you might have had today, either with our congressional representatives or whatnot, in regards to the language that we're anticipating to see for the $900 billion coronavirus relief package. I know, I think in every iteration it's been talked about, there was going to be an extension of the $1.25 billion CARES Act for us to continue to use that. I'd reached out this morning. They hadn't seen any language yet to be able to tell me one way or the other, but I think everyone seems to be fairly confident that that language will be there. So I just didn't know if you had talked to anyone and had heard that the language was definitely going to be there. So if you want to elaborate on that more, you can, but you kind of answered my question. Thank you.
Well, Stephen, I thank you, and you're always on point. And I think what I know is just this, and here's. And I have not seen the final language, but I know a lot, that's in there. Naturally, we're getting updates, nonstop. But the net of the whole thing is just this, and I think I'll just touch on it real quick. From the standpoint of state and city funding, that's laid aside for right now. From the standpoint of limited liability to our businesses or whomever it may be in regard to people that are getting COVID and whatever like that, that's laid aside. From the standpoint of the dollars, I think just short of $1 trillion. From the standpoint of a real influx going into the PPP program that allows people, if their income or revenue at their business, a restaurant, whatever it may be, is less than 25%, I think that's the number that's going to come out, for a certain period of quarters or whatever like that, they can apply. And this should be a significant amount of dollars that can flow back to our businesses and everything. From the standpoint of the employees, that have been, are going to get a stimulus package and everything. And that stimulus is going to be, I think it's going to be $600. And then there's going to be a bonus of, to the unemployment of, I think, $300 a week, in addition to the unemployment stuff. As far as real live money that's going out, that's set aside in this thing to do the vaccinations that we need to do and additional testing that we need to do, I think those monies are there. I don't know the language at all yet, and I hope and pray that those are significant enough monies for us to be able to do one of the things that I think surely needs to, that is right on the table and everything, and that would be able to test all of our 18 to 35-year-olds that are in our colleges and universities especially and everything, and to do that every other week, or at least do it in a way that we can really attack that situation. You know, I saw an article that was written and said that I was blaming this problem on the 18 to 35-year-olds, and it's just nut job after nut job stuff that comes out. I mean, I have never seen anything in the world like that. What I'm trying to do is identify people that are asymptomatic, that are going and they're being with mom or grandma and everything, don't have a clue in the world that they've got this and everything. And if I can help them stop that, that's what I want to do. Now, but with all that being said, the last thing I would tell you is I do think there's an extension of the CARES money on how we're going to be able to handle that and do that. I think there's a possibility of significant money here that is going to be coming in addition to this to highways, you know, to where all the states are going to get a little cut of money to come back to highways. It's almost like revenue replacement to highways. So there's a bunch of stuff and that's coming and everything, but that's pretty much the outline as I know it.
All right, thank you, Stephen. Next to Haley Kosick with Nexstar Media.
All right, hi, Governor and panel members. My question is, with multiple vaccines now available and other vaccines pending FDA approval, is there any preference on which vaccines residents should expect to receive in the coming months, or is it too early to say?
Okay, I think Dr. Marsh, you're the medical guru that's on here, or Dr. Amjad. Dr. Amjad could maybe answer this. She hadn't answered the question right yet. Dr. Amjad, it's up to you.
All right, Governor. Hi, Haley. No, we recommend as they roll out for the citizens to take what's recommended at the time. I mean, we have Pfizer and then Moderna coming out, so we do have the recommendations that do come out, but we do recommend that as they come available for citizens to take them as they roll out. But I don't know if Clay has anything additional to add, but there's not a preference as we have so forth. But Clay, I don't know if you have anything additional.
The only other thing I would add on is that these vaccines are really so similar that either vaccine should be seen as being the same. The only difference, as I mentioned earlier, and General Hoyer mentioned too, is the way the Moderna vaccine is made. It's a little bit easier to store. It doesn't require such ultra cold temperatures, but functionally these vaccines have been found to really give us almost identical results, both about 95% protection, both with very few, if any, side effects other than local problems on, at the immunization site, like a flu shot or something like that in most people. And so I think that our citizens should feel very comfortable that whether you are slated to get the Pfizer vaccine or the Moderna vaccine, you're getting a very safe, very effective vaccine that should be seen as really being equal for all the people that have that opportunity.
All right, thank you, Haley. Next to Phil Kabler with the Charleston Gazette-Mail.
Hey, everyone. Regarding the mutation of the virus in the United Kingdom, have we seen any evidence that that's reached the United States in general or West Virginia in particular?
Dr. Marsh, you got to do this one. It's way above my pay grade.
I'm happy to, Governor. Thank you, Phil. So we do know that the virus is an RNA virus, so it does mutate frequently. I think that the concern in the United Kingdom, which seems to be more limited right now to that country, is that there are several mutations in the spike protein that may be working together to enhance the sort of the infectability if you become, exposed to COVID-19. And what's really important here, and that's the reason why there's been a lot of effort to restrict travel right now from the UK until this is better sort of determined. And the series of mutations doesn't seem to have reached other places, particularly as I understand it, We haven't seen that in the United States at this point, but it just underscores the idea that we don't want people to be infected. And the way to cut down the infection, the transmission of the virus, is wear masks, stay distance, be very careful about who you engage with, particularly inside, and particularly around the holidays, where people really are spreading today at small family or friend gatherings where people just aren't wearing masks around each other. And so it's really, really important as we see this happening internationally, and we can presume that that's going to move over some time, that it makes it even more important during these winter months where people are inside to be extra careful. And as the governor said, wear your mask. If everybody wears a mask, we impact the reproduction score, the spread from person to person, better than a vaccine, because we immediately have maximal impact of that, whereas the vaccine takes time to build up those immune response, the antibody levels. So thank you.
All right, thanks, Phil. Governor, back to you.
Okay, I've got just 2 or 3 things I want to touch on real quick and everything. One of them that, and I want to defer back to Dr. Marsh about this and everything. So I want to say this, but I want to jump back. I think that we pretty much know. This isn't, we don't know. The Pfizer and Moderna vaccines, we know, are 95% plus effective today. We got that, okay? I think that we have been told that the vaccines that are in the works with some other different companies, it may very well be that effective rate may be 75 or maybe 80 or whatever it may be. But we know how good the Pfizer and Moderna vaccines are right now. And so we really need to encourage. If you sit on the sidelines and don't take vaccines and everything, thinking, well, I'm better off to wait and see how everything goes and everything, and I see the logic behind all that and everything, but you may end up in a situation to where we're trying to vaccinate everybody, and maybe some other vaccines have come online and they're pretty good, but they're not just as good. But Dr. Marsh, am I right about that?
No, you absolutely are, Governor. And remember, the Moderna and the Pfizer vaccines are really the same approach to making the vaccine. AstraZeneca and Johnson & Johnson's, which are other vaccines that are sort of trailing right now, Pfizer and Moderna, are made very differently, and they're made alike, but different than the Pfizer and Moderna. And I think what the governor says is true. Right now, the most effective vaccines based on the data we have today and the safest vaccines are the Pfizer and Moderna. So it's really important that people take that when it's your chance.
Okay, well, that's about as scientific as I can get, but nevertheless, I've read that and heard that, and I wanted to pass that on to our people. Now, let me pass on just something else. Secretary Crouch is right. He's dead right about this, that, the people that are working this, and they've done an incredible job. That's all there is to it. All the healthcare community, unbelievable what they've done. We all know they're tired. All of us are tired. We all know that they surely deserve, and we want them to spend time with their families. But at the same time, I know, and I'll promise you this, you may think this is hard-nosed, but I know people are dying. And I know that we're going to assist all those. We can't have people work 20 hours a day forever. There's no way. But we can find a way to assist where they can take some time with their family, and some way, somehow, we can back that up some way and continue this effort without missing a beat. I'm never going to ask you, West Virginia, to just say, well, look, we're really working real hard here and everything, and therefore we're going to lay down just a little bit because we have to and everything. I am totally sympathetic and totally appreciative of the effort. But I know just how good West Virginians are. And I know this, that if anybody were to call me and say, we got to have more help, I'll do anything and everything to get them more help, and I'll get them more help. Now, you as West Virginians can help us in just doing this. Just if you can go get tested now and everything before Christmas and all that, do it. Do it, because it does help those that have given us so much. It's unbelievable how much they've given. But we're not going to let down. We're not going to let up. And you may think that's too tough from my standpoint, but people are dying. That's all there is to it. And we can't let up. There's no way. Now, one other thing I'd like to just share with you, just this, is the national news right now. All over the national news is West Virginia. West Virginia leads the nation. West Virginia is absolutely administering our vaccines better than anybody else. West Virginia, West Virginia, West Virginia. They were the first to go in and test all the nursing homes. They're going to be the first to get all of our nursing homes and assisted living done. They're absolutely racing ahead of everybody. Little old West Virginia, West Virginia, West Virginia. And over, they almost turn and say, why in West Virginia? Now, you know what I'd say? I would say just this. Why? And I'd put a question mark by the why, and then I would answer and say, because it's West Virginia. You just keep doing it, West Virginia. Thanks to so many, many people out there that are doing great work and everything. But that's why. That's exactly why. The why is not, why is this going on in West Virginia? The answer is just as simple as this. Why? Because it is in West Virginia. So anyway, I love you with all my soul, and I mean it. I mean it. I don't blow smoke at anybody. I try to tell you the truth. I love you with all my soul. You just keep doing it, West Virginia, and thanks to all those great people that are really putting in the licks to make it happen.